Today we are going to analyze the types of surgery, and surgeries are classified under different parameters. And these parameters include, there are 5 in number. The first one, it's based on the timing of the surgery. The second one is based on the body parts being operated on. The third one is based on the equipment being used. And the fourth one is based on the invasiveness of the procedure. And the fifth one, it's based on the purpose. So let's tackle each at a time. And we are going to start with the timing of the surgery or the procedure. And they include there are 4 types in number. We've got the first one as elective surgery. This is a type of surgery which is planned in advance, and the patient can await for the surgery while he or she is in the ward or even at home. And we have the second one, it's semi-elective. Under this semi-elective, this procedure or this surgery has to be done or must be done, though it's not immediately. We've got the third one. The third one is urgent surgery. The urgent one can await until the person or the client being operated on stabilizes, let's say, or medical stabilizes. For instance, a person or a client who has elevated sugars or raised up blood sugars, the surgery can't go on not unless they wait until the blood sugars are stabilized so that they can continue the procedure. And we've got the fourth one, and it's the emergency one. This has to be done without delay in order to save the client's life. For instance, a person has been involved in an accident, and the delay, if this patient is delayed without being done, or the operation is not done to him or her, he might lose his life. So he have to undergo the emergency surgery. And let's tackle the second one. And the second one, as if you can remember very well, we said that it's based on the body parts being operated on. As the name suggests, it deals with the body part being operated on. For instance, we've got various of them. We've got like cardiovascular surgeries, and this involves surgeries dealing with heart disorders. For example, open heart surgery, like transplant. Yeah, we've got gynecological surgeries. These surgeries involves only female reproductive system, the uterus, ovaries, and all that. We've got the other one, it's orthopedic surgeries. This one deals with bones. For instance, one has got a open or a closed fracture. He or she is going to be operated on orthopedic surgeries. For example, total hip replacement, and what have you. And we've got the third one, and the third one we said we've got it's based on the equipment being used, and we said that this one depends on the equipment that are going to be used in the whole procedure. And actually there are 3 in number. We've got the laser surgeries, and these ones, they use lens, and most commonly The eye procedures or eye surgeries, this is where this procedure is done, laser surgeries, in order to correct the long-sightedness and short-sightedness. And we've got the microsurgeries. And the microsurgeries involves operating on microscope, for instance, to see some tissue, small tissues or veins. The surgeon would, or he or she might prefer to work at a microsurgery where he or she is going to use a microscope. And we've got the robotic surgeries, whereby surgical robot being instructed by the surgeon to do the instrumentation, but they only operate under under given instructions by the surgeon.